Intermediate, so we can do the witties or the I, T's, and Y's that we did last week. So those are scapular stabilization exercises to start off with. Then we can progressively add some weight. So we went through those last week. Shoulder and scapula very closely tied together, and especially as we get into these higher level exercises, you have to have scapular stabilization in order to perform them effectively without causing injury. Band resisted shoulder motions, all directions. So I did the stepping. We can do the bands for all of our different motions. So Brian had started us with some active and active assisted and passive exercises. So once your patient can do their motion, they can do it with the cane, they can do it actively, then we can add some flexion. They could just stand on the band, no problem. If this were a bilateral weakness issue, we could have them stand on the band and do both at the same time. Okay, most often I'd say we're looking at unilateral issues, so one side is effective. So I can do flexion, I can hook the band into the wall and do extension or do rows. I can hold on to the band or again put it in the doorway and then work on external rotation, turn around the other direction, work on internal rotation. When you do internal and external rotation, I would say more often than not, I put something between the patient's arm and their body, again to keep this slightly slacked position so they're not jamming straight into adduction, which isn't necessarily comfortable, but also to give them the cue that they are doing the pivoting or the rotating here in internal and external rotation and not lifting and abducting or bringing the arm back and forward. You'll see people go through these doing all kinds of interesting motions. So if you put something here, that's going to give them a cue. Keep your shoulder in position, keep a slight squeeze on that towel, because if they start to move their arm and get out of position, the towel is going to fall. So that's going to give them a good cue. It's a nice tactile cue that they can maintain. So with bands, how do we progress? Stronger band. Yeah, you can step away a little bit further, so tighten it up. Then you can double them, and you can also then go up in color. And it's a big graduation for a lot of patients. Oh, do I get to go to red? Do I get to go to red? Can I go to red? Can I go to red? Oh yay, did I get to green? So it's pretty exciting for patients. So that is also a motivational factor when they can graduate to the next color of band. So we can do all the different directions. We can also do diagonals. So we had done with our scapular stabilization, we'd done our X's, so we can do the same thing. Working with the shoulder, we can also do, if we were standing, we're going to go through PNF next week. I keep teasing you with PNF, but you can go through PNF diagonals, holding onto your band. So this way the direction of force is downward. If I wanted to go the other direction, I'd have to hook onto the wall or hook into a door jamb to go the opposite direction. So be aware of your gravity, be aware of where your resistive force is and the position. We're going to talk a little bit more about that in a few minutes, but realize that if you're using a band, your resistance is only going one direction. If you're doing active in a standing position, your resistance is only one direction. You could get somebody in the water now, and you're doing flexion and extension, and there's resistance each direction you go. There's resistance each direction you go. So be aware of what your environment is with these. Selectorized machines or cables. So I think probably all of you have been in a gym, worked out in a gym, or at least seen some gym equipment. If you stay up very late at night, you're going to see all kinds of interesting gym equipment these days. I'm waiting for my Brazilian butt lift. Yeah, interesting. I like that. They're fun. So you can use the selectorized machines. All that means is you're putting a pin in a machine, adding more weight, so you can do things like chest presses, and you can do rows. There are lots of different shoulder machines where you can do flies, forwards and backwards. Be very, very careful with your form. Some of you may be in clinical sites or in jobs where you're PT clinic is located directly in a health club, and you'll see all kinds of crazy form, and you're going to take your patients out and go, I'm going to show you the right way that I want you to make sure your seat is positioned so you're in this position, so you're not in the chest press machine and doing some weird position. I want to make sure you are stable through your scapula first before we add these extra items. So making sure people tend to want to increase their weight, and they want to show off, and they want to, they want to feel like they've done something, but sometimes you have to have 10 pounds on that machine and really focus in on your form, and that's going to do you much more good than trying to put 40 pounds on the machine and do this. So just watch your form, because our goal is rehab. We're trying to get someone strong and strengthened and balanced out because they've had an issue. It's not, I'm bodybuilding and I need to put certain forces on my muscle in a certain manner to shock my system to get hypertrophied. Think about the goal. So you have to realize what you're trying to accomplish with your therapy. Let's see. Lat pull down. So with the machines, we had talked a little bit last week about some of the things you can do with the rows. So you can do the lat pull downs like we talked about with setting the scapula with just pulling down. So holding on to your bar and just pulling down. You can do the same thing with a band. So you can use a tube or a band and put it in the door. You can have a long one with me. But tie the knot and put it in the door so someone can either sit down or stand and work on shoulder blade control first, and then you can have them pull down into their motion. So you're really cueing, you have to get the shoulder blades going first. That has to set, that has to lead the motion first. Same thing with your other rows, making sure that the shoulder blades engage first, and then pull. So there's a lot of thinking involved in these exercises. We'll get more into bicep curls and tricep extensions next week with the elbow, but just realize any exercise that we do from the shoulder out, we have to set the scapula first. There's no way that I can work my biceps, triceps, wrists, hands, anything without some shoulder involvement and some scapular involvement. I mean, even if I just have my arm on a table doing wrist flexion and extension, I still have to have some shoulder recruitment and involvement. So let's make sure that we're thinking about it and in a good position, in a good place. Band, PNF, manual PNF techniques, again, we talked about some of those. For strengthening, we can do a lot of the isometric, alternating isometrics. We can do the PNF diagonals that we'll go through, adding band, adding resistance. I'll have people do PNF lying down with the weight going through the motion. I'll have at least one or two good stories about that when we do PNF. Let's see, body blade. Yeah, somebody bring a body blade out here for me. So we talked about the body blade as it relates to core strengthening. So you definitely have to have some good core strength to use this. But think about what we can do with the shoulder. So if my right side is affected, I can get in a good stance. I can do just a vertical, quick flexion, extension. Okay, so I can just do this vertically. I can then have someone go side to side. So now I'm doing a quick internal, external rotation. Okay, I can have people hold and do more of an overhead motion.
It's still technically an isometric.
It's not isometric, it's called triphasic. You've got this quick contract, release, recontract, so the muscles are constantly recruiting and unrecruiting in a cycle.
Yeah. So
it's not a constant isometric hold, it's a quick on and off. Whereas if we do a weight, it's on, concentric, and then it's off, or then it's eccentric. Or if we do an isometric, we're just holding. This is kind of a nice combination of all of them. It's a really quick on and off of the muscle fibers. Okay, we can go through range of motion. So I really like to have people start down here at the side, get it flying first, and then have them start going out into a small range of motion. Abduction, a small flexion. Okay, just have them work through range of motion.
Is it stretching at the same time as it
it's not a
Just a mini
stretch.
stretch?
It's not a stretch, it's just keeping on and off, different muscle fibers are on and off, so it's stabilizing, and it's a quick reaction.
Okay.
So these muscles are having to react because if you think about, a lot of times, patients will re-injure or they will get hurt during the deceleration phase of something, so they can get force going, but you can't stop the force. You don't have strength or control to stop it. So this is working on our ability in a very small range of motion, a small scale, to push, so I generate force and then I have to stop it and then pull it back quickly. So the opposite muscles are contracting, stopping, slowing down, pulling back in less than a split second. I can't tell you how many patients I've had that I've had in for their shoulder, they're doing better, something happens, they're eating, and they drop something, and they go to reach and grab it, and they flare up. Even though there was no real weight to it, but it was just that quick movement, deceleration, and that was enough to re-tear or really flare them up. So working on that deceleration control and being able to react quickly, this works really well. So if someone has a specific sport or an activity or something that they do, I had a gentleman that was, I think I told you that he created his own with PVC pipe and putting different bolts of different gauges on the ends of it. He was into some sort of martial arts, and so he'd go through his whole martial arts routine with these, and he'd just go through the whole thing. And I've had javelin players or javelin throwers, baseball players, and I'll have them with these. They have smaller ones. They have a really short cardio blade, then they have an intermediate one, and then this is the pro, this is the heavy one. So this is a little bit heavy, so if someone is pretty weak, you may have to start them with a smaller one, but you can get them going with two at the same time. But you can have somebody just hold these and go through whatever motion it is, and that's going to work those fibers very, very quickly. So body blades are really fun. They have to have good core strength, but you're also looking at increasing their core strength while they're doing these. Right, so in our advanced exercises, push-ups on the ball, the BOSU, a balance board. We talked last week about how to progress exercises. We can change gravity or their verticality. So if I'm doing a push-up standing upright, less pressure. If I get more horizontal, now this is harder than if I go all the way down into a pure horizontal position. That's going to be the hardest. Then I can make things harder by putting them on a ball. Now I have to stabilize more so, kind of like with the body blade, you're having this unstable surface that your body has to react. So you can have someone's hands on the ball, you can have their body on the ball and their hands on the floor. Anything that's going to give them an unstable surface. There are different types of plyometric exercises that we can do for my pitchers and throwing athletes. They make little plyo balls. Have you ever seen plyo balls? They're kind of like the little rubber balls you played with as kids, but they're heavy, and they come in different weights. They have just little small ones that are weighted more than just a baseball or a softball, and so you can throw them at a rebounder, a little mini trampoline that's up at an angle, so someone can throw and then catch it, throw. So they're working on that deceleration that I was just talking about, that they have to be able to stop their motion, not re-tear, so you have to have enough tensile strength that they're not going to rip as soon as they release, and then they can catch it on the way back and control. So plyometrically throw and back. You can start with two hands, so they have an extra hand to help. You can throw back and forth with that person, so you can control the tempo. With my pitchers, because so much of their force is coming up here, I will get them against a wall and just have them throw. We call it dribbling. You can just dribble the ball against the wall. If you don't have a little plyo ball, you can use a bigger ball like this, and even think about this. That's a plyometric. Having a basketball, if you have a shoulder issue, you have to be able to push, release, control it back in your hand, push, so you can have someone dribble up against a wall. using a basketball, using one of these, anything that's going to give them that plyometric feel. People doing push-ups, you can press off and then catch yourself again. So doing anything that's going to cause that plyometric, that ballistic, that quick motion. Yeah, have people down in a push-up position and have a step in front of them and have them step up and step down or step over and off and up, depending on, it is terribly hard, terribly hard. So depending on how far you're wanting to take this patient, these are going to be more high-level patients that have to do a lot of upper body work. I have had a lot of plumbers. Think about them getting underneath cabinets and having to do all these things in these positions and reaching around. So I've had a lot of people with shoulder issues from work like that, where they have to get in really bad positions, and trying to keep your posture in that position under someone's cabinet and counter, and mechanics. So doing things that are fine motor or ballistic are really, really effective when you get to that later stage. Okay, so it's not just necessarily band work. Think about as functional as you can possibly get to work with someone. And really, cueing is huge with the shoulder. Just like we talked about and showed with your manual muscle test and range of motion, this happens so much. If someone is weak through their shoulder, they are, I guarantee you, 100% going to elevate the shoulder. So you putting your hand on their shoulder and cueing them, keep that down. Even if you can only go this far with your flexion, keeping the shoulder in a good position, I'd rather you only do 5 repetitions to here than to cheat here. Like Brian says, garbage in, garbage out. You're training your body to do this if that's all you're doing. So parking them in front of a mirror, giving them visual feedback, giving them tactile cues, that's what you're documenting, that you're having to cue them to prevent or correct these compensations. That's going to be skilled. That's why you're valuable, because they could go home and do this all day. They're going to be back to see you again in a few months because they're just impinging and they're not using very good form. Okay. So those are all some good shoulder exercises. This is just a taste, just a sampling. There are tons of things. There are tons of vendors with lots of different equipment. There are, have you covered knee in ortho with CPMs?
Yeah,
So
we're just doing that.
Okay, so there's a shoulder CPM, all kinds of specific equipment. I like to use old school things you can find around home and things that you can use as much as possible that patients don't have to buy. But there are tons of things out there being marketed specifically for rehab that are great things that you can try out yourself and see what it feels like, and advise your patients accordingly.